world. There are certain rights that people have in the world. And one of those rights is the right to good health. We are dedicated to reducing the differences in health between the poor and the rich, between the haves and the have-nots. We do this by working with 9 different schools, many different institutes, many faculty, all of whom are dedicated to the field of global health. We work really all over the world. Our initial efforts, though, over the past few decades have been in Tanzania, originally in Dar es Salaam and now in Moshi, where we work with the Kilimanjaro Christian Medical Center.
The types of research that we're involved with here in Moshi cover HIV treatment, care and prevention, and include a wide range of research sites from the laboratory to the clinic to the community.
In the year 2003, Kiwakuki was doing the VCT, voluntary counseling and testing, at this center by people paying 1,000 shillings. This was not possible for people to pay. When Duke University came, we sat together and we did a study. And this study showed that the 2 weeks which we were doing the study, so many people attended the VCT because of free VCT.
We found a much higher seroprevalence rate among women than among men. We were able to bring back to our colleagues at Kiwakuki and help them rethink some of their prevention strategies. We came up with the idea of going out into rural communities with a mobile HIV testing service. And we've been able to perform community-based surveys to try to understand what the needs really are, and then offer HIV testing.
So that you're aware of the content to those discussions, and I think
the hospital certainly has the mission of being able to provide health care to the population. It's supposed to do research, and particularly research to answer and manage health problems affecting the population, with the input from collaborators like Duke, who have more facilities, more experiences in this particular field. And that has been part and parcel of our strategy, to utilize their experiences to build up our own professionals and our own laboratory capacities.
Kiwakuki is the group that came to us and said, we are working with children who are orphaned by AIDS here. We're providing community-based care. We'd like to be doing something more. And we'd like to work with you to see if there are some research projects here. And so we went for the first summer and did 2 pilot projects, one with children who've been orphaned by AIDS, in looking at how they were doing. We looked at kids both in institutions in the area and in the community. And so we went to each of these places and started looking at what characteristics might make a difference to a child's life.
I was found HIV positive in 2003 when I went to KCMC to check my status.
Kiwakuki supported me for education, then I'm healthy. Now I'm in secondary school because now I feel good.
We are so impressed by the enthusiasm of our undergraduates, wanting to take classes, to go do projects during the summer, wanting to have careers that build on their experience at Duke. We're developing a very unique master's program in global health. It is going to train interdisciplinary scholars. It's going to train future leaders and researchers in global health who will know how to approach global health using various disciplines to solve problems.
I think I have an obligation in order to facilitate this interdisciplinary field of global health and understanding how what I can contribute will fit into a larger picture.
This is a wonderful time to be in global health. Great challenges abroad, similarly great challenges here locally in Durham and in North Carolina, and we in the Global Health Institute are very excited about addressing these through our 4 pillars of education, research, policy, and service.